So a phobia is basically an extreme fear reaction to a specific trigger. For example, a spider or other objects. It could be really anything. It could be also in the form of a thought trigger, uh, as in agoraphobia, the thought of not being able to get back home to a secure place, making it very difficult to leave home. So a phobia basically is just an extreme emotional reaction of fear that is triggered by a specific experience. And the best way to overcome any kind of phobia basically is a combination of two things. The first is some form of exposure therapy. In our case, we will be looking at mindfulness-based exposure therapy. And the second thing that we need to do is actually look at the imagery of the fear emotion itself and how that works. So fear is an emotional reaction, and all emotions are structured around imagery. So typically, for example, a spider will trigger a large threatening image of a spider or some other threatening image in the mind. And that is what actually produces the fear, is that internal picture of the spider. Now, this is simply a conditioned habit, and once we uncover that imagery, we can begin to change it. So this is the process that I developed several years ago now, called mindfulness-based imagery processing. It works very well for PTSD as well as for traumatic images and memories and experiences, and also for phobias, which have many of the same characteristics as traumatic imagery. Typically, the images are very large, very close, and often very high in the psychological field in which you see the emotion. And that's what gives it power. So once we uncover the imagery, we can change that imagery. And when you change the imagery, you change the emotion. So this is one part of the work that we do, is reprocessing the way you see the spider, for example, in the mind. We might simply make it very much smaller. A small image is not able to generate the same degree of fear that a large psychological image would do. There are many other factors that we can change in this internal imagery. The other thing that we need to do is change our relationship to the emotions, to the fear that gets triggered. So many people develop a fear reaction to the fear, and that simply feeds it and makes it worse. So we need to turn that completely around and actually develop a very friendly relationship to the fear. That friendliness stops the fear controlling you. It allows you to get control of the fear, but you must generate an internal friendly attitude towards your fear. When you do that, the fear begins to diminish by itself. Good analogy here is to think of a scared child. Think of the fear reaction, the emotion in you, as being like a scared child. The best way to help a child overcome its fear is through contact with you as a parent, as a fearless person who is not afraid. And the child absorbs that confidence and fearlessness, and that allows the child to let go of its fear. The same process happens with our emotions as well. So we learn to develop a mindful relationship with our emotions. We learn to sit with our emotions in the same way that you would sit with a child that was afraid. And this is very important for healing. We must stop that emotional reactivity to the fear. So the combination of image reprocessing and then establishing a non-reactive and friendly relationship to the fear itself are the two primary features in mindfulness therapy for phobias. If you approach a phobia in this way and test out your work by exposing yourself to the actual trigger and do this repeatedly, you will rapidly overcome your phobia. Most people that I work with can significantly change their phobia within a matter of weeks if you start doing this work that I will teach you during the online therapy sessions. So if you're interested in mindfulness therapy for overcoming your phobia, please reach out to me by email and let's schedule a session. Thank you.